went all over the place with my pathway, but I realized that I had ignored this strong feeling that medicine was for me. And during pharmacy school, I was struggling to figure out what I actually wanted to do. After I had that huge life change again, I was like, okay, I'm just going to go for it. I'm going to pursue the thing that I've been ignoring this whole time.
Welcome to the Physician Pharmacist Podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland, and I'm a licensed pharmacist, and now for the first time happy to announce that I'm finally a physician, having graduated medical school. I'm also on the horizon of starting my anesthesiology residency training in the coming weeks. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. As this podcast has grown, we've had the tremendous opportunity to broaden our scope and explore other non-traditional healthcare careers. Tune in to hear from our non-traditional experts serving at the frontier of medicine, technology, and innovation. Today, we have the pleasure of speaking with Dr. Samaya Cristina, who is a licensed pharmacist and rising MS1 at the Spencer Fox Eccles School of Medicine at the University of Utah. Having completed her pharmacy doctorate via a unique 3-year program, Dr. Cristina then went back to undergrad to finish up her prerequisites before starting her medical school journey. She currently serves as a clinical pharmacist in the emergency department and looks forward to sharing her journey into medicine. All righty. Welcome to the podcast today. Super happy to have you.
Thank you. I'm really happy to be here.
So let's kick things back off at the beginning. What was your life like before going to pharmacy school, and where are you from?
Yeah, so I was born in Cleveland, Ohio. I actually grew up most of my childhood in Knoxville, Tennessee, and I got into pharmacy at the young age of 24 after doing some other odd jobs and kind of figuring out what I wanted to do. I'm a first generation student and didn't have anyone else in healthcare growing up, so my pathway is a little bit confusing.
I can definitely relate with that too. I'm the only individual in my entire family who has kind of had any background in healthcare. So I can understand the struggle of kind of introducing this idea and all the things that go into applying to medical school, applying to pharmacy school, and just getting into healthcare in general is very challenging. So that's awesome that you were able to find pharmacy in the first place. So then what prompted you to consider pharmacy?
I had some coworkers at the time. One was previously a pharmacy technician at a local family pharmacy. Again, I was working in fast food, so very modest beginnings, but she told me she loved the job, and I kind of looked into it and thought it would be something I could make into a career for myself. So I looked at a pharmacy technician program that was local and started working my way towards that. And I landed my first job at Walgreens.
How many years were you at Walgreens before you decided to pursue the pharmacy path, like to become the full doctorate?
Yeah, so I really loved it. It was my first time doing like anything healthcare related, learning about insurance, dealing with patients, and seeing what my boss did. After about a year, I decided I was going to go to college and become a pharmacist. So that was the initial goal. And I was 25 at that time. And I started undergrad at 26.
Wow. And so with the undergrad, was that part of the pharmacy curriculum, or like did you do a 2+5, or you had mentioned previously that it was a 3-year pharmacy program. So how much undergrad did you complete before starting the pharmacy curriculum?
Yeah, absolutely. So I started at our local university. This was in St. George, Utah. And I just did the basic prerequisites to apply to pharmacy school. So I started with biology and math, chemistry. I did my chemistry series. Some pharmacy schools recommended biochemistry. I opted to skip that. And I actually did not take physics because the program I ended up applying to, which was that 3-year program, did not require it. So I ended up doing 2.5 years of full-time undergrad, applying to one program, early decision, and was accepted.
Wow. And I think it's really unique that the program that you went to is only 3 years. I think a lot of people would have rejoiced to have like a 3-year pharmacy program. So I'm assuming though, because that it was 1 year shorter, did they pack everything in around the clock? No summers, no time off. What was that like?
Yeah, exactly. They do a pass-fail system. This is Roseman University of Health Science, and they do a pass-fail 90 percentile system. They do a block kind of schedule. So every 2 weeks, we would take an exam, pass our exam, and then move on. It was rigorous and quick. However, they being a 3-year program, they do cut the fat, so to speak. So certain subjects, I felt like we didn't cover very much in depth, especially subjects like medicinal chemistry were really lean, and they started getting into the drugs and the clinical aspect a lot sooner, I think, than other programs. I talked to some of the University of Utah students, which are the other pharmacy school here in the area, and they have a traditional 4-year program. The first year is a lot of review, all that biochem and molecular biology and such. And the students are like, oh, I can't wait to get to the clinical stuff. So they just takes them a lot longer, I guess.
Yeah, absolutely. I did the 4-year program, well, 2+4, and I definitely that first year of pharmacy, go into the pharmaceutics and all that stuff. I was like, oh my gosh, can we just get to the drugs already? So that's really cool that you're able to kind of have an abbreviated start to that. And that's part of the reason why a lot of the pharmacists even go into the profession is because we love that clinical aspect. So it's nice that you were able to focus on that with your education. And so with that in mind, what was your favorite part about pharmacy school?
Yeah, absolutely. I think my favorite part was our P2 year because that was our quote unquote clinical, like preclinical year, so to speak. And it was just disease state, treatment guidelines, pathophys, and pharmacology. And that's also when I had decided at that point I wanted to apply to medical school. So that was my favorite part. Third year was also great. That was our rotation year instead of fourth year. Um, at that point, I was shadowing physicians and working with physicians. So it's hard to say. I think I liked both the preclinical year and the clinical year most.
Of course. Yeah, it's a good thing you didn't say my favorite part was finishing. But no, that's awesome. So you had kind of started to get into this clinical role, and I think that's where I fell in love with the medical aspects of it, where I enjoyed the pharmacology, but then I started to see like how we're using these drugs and all these disease states that we're managing, and I was curious to know like, okay, well, I understand the drugs we use, but how can we like I want to learn more about how they got to this diagnosis in the first point. So that sounds like that you had a similar pathway.
Yeah, exactly. The way I explained it to my pre-medical advisor, and shout out to Denise Fulmer at Utah Valley University. I reached out to her while I was still a pharmacy student and asked for her advice. And she said, I don't think I'll ever see this girl again. But like, she ended up helping me get into medical school later. Um, so shout out to Denise. I guess when I tried to explain it to her, it felt like on pharmacy school, if we think of diagnosis and treatment, patient care as a circle, diagnosis and coming up with treatment plans might be one half of the circle, and then the treatment and the medications would be the other half. And I thought I was missing that whole half of the first side that I wanted to explore. So it'll be really cool to see like the final piece of the puzzle be filled in during medical school, if
Of
that makes sense.
course. Yeah, of course. And obviously that probably solidified the fact that when you were on appy rotations, like now you're in the wards seeing how medicine is like, administered to patients, and it becomes very apparent. I'm sure that's where like you knew for a fact, okay, I'm on the right pathway. I need to pursue medicine.
Yeah, absolutely. So my story to why I switched to medicine started a little bit earlier. I'm not sure if you want to go into that yet.
Sure. No, I'd love to
Okay.
hear it.
So it was actually on my way to pharmacy school, I started exploring other careers. And I went to undergrad specifically to become a pharmacist. And I'm very goal oriented and I'm a planner. So I wanted to stay on my pathway there. However, I got involved in our pre health organization at school and got to volunteer at a free clinic. And I actually did a medical service trip to Nicaragua before I applied to pharmacy school. And it was out of the country in Nicaragua that I was like, wow, these doctors are so knowledgeable. I love this patient interaction. The first patient that my team of students and physicians saw was an elderly lady who had tissue necrosis of her leg. And my mind was just blown. I was like, I'm seeing all these drugs and I'm seeing this insurance side of things, but actually meeting this 91-year-old lady with like this very physical problem and getting to try to help her with that was when I realized I wanted to become a physician. So I was about to apply to pharmacy school at that point, and I just had this huge epiphany and I just squashed that down and I said, I have my plan. I'm going to stick with that. And once I was accepted to pharmacy school and went through pharmacy school, I kept that plan. I was going to become a clinical pharmacist. In 2020, COVID happened. I actually had a huge life change. I got divorced and started rethinking everything about what I wanted to do and ended up with medicine. So kind of went all over the place with my pathway, but I realized that I had ignored this strong feeling that medicine was for me. And during pharmacy school, I was struggling to figure out what I actually wanted to do. After I had that huge life change again, I was like, okay, I'm just going to go for it. I'm going to pursue the thing that I've been ignoring this whole time. So,
Yeah, that's really interesting. And I think it's a common experience for a lot of individuals who want to make that transition where they are interested in the medical side of things. They start pharmacy school and it doesn't quite scratch that itch where you've always known, like deep down, like I wanted to pursue medicine, or I wanted to, kind of get involved in that sphere. And so it sounds like you obviously, came to that epiphany and obviously went for it. So, kudos to you for doing so. And you had decided before you had even graduated pharmacy that you wanted to pursue medicine. So did you ever consider doing like clinical pharmacist residency opportunities at that point? Because I get a lot of questions, and the reason why I'm bringing this up is that people will ask me, well, do you think it makes sense to do the residency to make myself more competitive for medicine? So I'm curious to know your perspective on why you may or may not have considered that
mhm.
opportunity, and kind of how you went forward with building out your medical school application.
Yeah, I did so much research when I decided to make the switch. Every Reddit post I could find, your book, anything I could find that could help me figure out how to do this path was super important for me. I read the opposite side, someone who had thought about going to medical school, but pharmacy residency actually scratched that itch for them. And they realized I could do this, be cardiology pharmacist, and I don't need to go to med school. Um, but for me, I felt like I would be losing another year to pharmacy where I knew that I didn't really want to end up there. Um, while that clinical knowledge could be very helpful, I think it's so dependent, I guess, on what your goals are. Um, but for me, a PGY1, I felt like it wasn't going to be necessary as I knew I wanted to go to medical school as soon as possible. So I don't know if that's
Exactly.
helpful at all.
No, absolutely. And I agree too, where like I've said it in the past, if you're really not intending to be a clinical pharmacist down the line, then, don't take that opportunity from maybe someone else who really wants to make that a career opportunity. And every year there's people who go unmatched at some of these programs. So
Absolutely.
after that, you had decided that, you're going to go to medical school, you're not going to do the residency. What was your life like then?
Um, I actually felt very isolated at this part. I was a top student in my class. I got an award um, even during graduation. A shout out, I guess, to my previous dean, but he said, well, Samaya has decided to go a different pathway in her career. She is going to be an asset to her patients. And I got an award. It was very reaffirming that I was making the right choice. But I did lose a lot of connection to my friends who did pursue a residency. And then I was back in undergrad. So I actually went back to undergrad 2 days before I graduated pharmacy school. This is how insane I was.
Wow.
And I jumped right into physics in the summer, cell biology, and NAPLEX studying and board. Like we do the MPJE for Utah. So I had to do all of that in the summer. And I was wondering, what the heck am I doing a lot of times because I was stressed out. Physics was a lot harder than I expected. Um, and I wasn't, working full time. I wasn't making as much money as some people were. And I just had to keep focusing on what my end goal was. So going back to undergrad was fun. I got to tell some people that I was a doctor already and got a lot of confused looks and ended up joining some pre-medical clubs, which was also great because I could tell people about my experience. I tried to talk to students who were pre-pharmacy, met a lot of great people.
Yeah, I agree with you entirely too. And like speaking on like the isolation of this, like it's such a tough thing to do where you just finished this long, huge achievement of becoming a doctor, you getting your PharmD in, and at that point in time, all of your friends went off to residency. They all started their jobs and they're, making good money doing
Mhm.
that. And then you're back in the classroom, kind of like starting all over again, doing these undergrad courses with a bunch of undergrad students who might have graduated high school a year before.
Oh,
And
yeah.
so it's definitely an interesting transition and it's tough because there's a lot of self-doubt where you're like, am I on the right path? Like I could be doing so many other things. So the opportunity cost is definitely something that weighs on you going down this journey. And, but obviously you didn't let that kind of hold you back. And speaking, you kind of mentioned too the MCAT. What was that like studying for the MCAT while working while in undergrad?
Challenging. So
Yeah.
I've said to lots of people that the MCAT is the hardest exam I've taken to this point, and that is true. I am a 3.9 GPA student, and I went through pharmacy school, so I thought, no problem, I can handle this. I expected it to be really hard, but I did a study plan of 6 months. It felt long. I
Hmm.
felt like it was a grind, and I felt like I stretched myself very thin at times. I went down to 12 credits that semester while I was prepping for the MCAT, and it still felt like too much, especially with work. And um, I think my saving grace was actually near the end when I decided I needed to give myself more time. And I actually postponed my MCAT another month and
Hmm.
studied on it after the semester ended. And that month kind of saved me. I ended up with a 513, so not bad. It was my first time taking the exam. I'm so grateful I didn't have to take it again because it was tough. I just tell people like it is a huge hurdle to overcome, but you like anyone can do it. It just takes that grind mindset and keep pushing. You have to just keep pushing and not quit. So
Yeah, that's great. And obviously, I'm sure you're very happy you gave yourself that extra month because a 513 is right on the money for what you need to get into med school. The average
mhm.
right now is around a 512, so you were slightly above average. I was a 510, but when I had applied, I think the average was 511. So yeah, it was definitely I was a little below average, but not enough that it would hurt me. But another question that, and we'll explore this a little more in the future, but or in subsequent questions. But how do you think like your pharmacy experience helped you get into med school? Was that a common topic of discussion?
Oh, yes, absolutely. So full disclosure, I applied to two medical schools, so also unique. um, I think if it wasn't for my pharmacy experience and all of the clinical experience I had amassed at that point, I would not have been a strong candidate.
Hmm.
I also think being non-traditional and being in the workforce can I can show a little bit more easily some maturity, some life experience, some understanding of I know what I'm getting myself into,
Hmm.
which I think some 22-year-olds may not have fully gotten to experience. What I'm trying to say is between my age, the clinical experience, and me going through pharmacy school, I had a lot to speak to, especially during my MMI. I felt like my MMI interview went really well because every question they asked was either a scenario I had experienced or something I could speak um, pretty well towards. And I have quite a bit more professionalism in my background than some 22-year-olds may have had. So,
Yeah, that's something I constantly speak about is how interviews, and I'm not sure if you read it in my book, but I was kind of like sharing the experience of the interview process where I felt so comfortable in the interviews because like we had been on the clinical wards. We've talked face to face with physicians before, like on a one-to-one basis where we're, working as a team and not just like some kind of underling. And so I feel like that provided a lot of confidence, a lot of professionalism, like you said, that made the interview experience very not easy, but I was very comfortable. And I'm sure, like, kind of what you're saying too. That was the best part about applying to medical school. The hard part for us pharmacy individuals, the non traditional stuff, is kind of getting all those prerequisites in when there's some of the content they cover is things we haven't seen in 5, 6 years, depending on, what kind of pathway you're on. And so I'm sure, like you were saying, that was probably the hardest part was obviously the MCAT, which is a lot of the content is undergrad material, let
Mhm.
alone just having the time to study for that while working part time. So
Yeah,
that's
absolutely.
awesome. Alrighty, so you obviously got a great MCAT score, and then applied. You said you only applied to two programs. I think that's really interesting. What went into your thought process about doing that? Because from a consulting perspective, I would tell you to apply to like way more programs than that. Because it's a numbers game. So like, what went into the decision to apply just to two programs?
Absolutely. So, I guess I'm not very risk averse, let's say that, because I seem to swing pretty hard and fast with my goals and just uh, try to do exactly how I planned and hope it works out. But at this point in my life, I'm getting older and I actually got engaged again. So
Congrats.
um, we are planning to get married this summer. My fiance is an engineer and I wanted to support his career goals as well. So now I'm balancing all these big life things together. And he recently got a really good job opportunity here in Utah. And so the decision was if I'm pursuing medical school, I'm going to stay in Utah. So it was definitely a sacrifice that I made for him and his career, but I couldn't be happier with how it turned out at this point.
Hmm.
He does realize that moving in 4 years is very likely. So, but for now, I decided just to make it work here and hope it worked out.
Yeah, that's certainly one of the challenges for a lot of non-traditional applicants is like we have so many other factors that weigh into our decision making of how and where we want to go for medical school. One of the common things is like the financial perspective too, where uh-oh, I have a mortgage. That's kind of hard to get up and leave and go to another state like on a whim, where like a college student might be able to just kind of like flow with the wind there. So
Yeah,
that's definitely another factor that kind of plays into this process. But it also makes you a strong pull for that particular region too, where you say, I have roots in the ground here at this university. Like, please give me a look. So that can kind of go both ways for you, where it could help you out, but also hurt you in some ways. So it's interesting. I'm glad it
I
worked
am.
out for you.
Yeah, I am very lucky. Utah is very state specific heavy, so they take most of their students from in-state. May not be good school to apply to if you're not from here, but for us, it's a top choice. I also applied to the local DO school and was accepted, so I had
Perfect.
options.
Yeah, that's always a great feeling too. So you've obviously been working as a pharmacist, but I don't think we've quite explored what you do exactly. So what is your current role, and do you plan on continuing this role throughout medical school?
Yes, I started as an intern with Intermountain Healthcare or Intermountain Health now here in Utah, and just worked weekends through pharmacy school. Kind of started building my network with the pharmacists here, and I was lucky enough to receive a job offer PRN after I graduated. Um, it was at another affiliated hospital with Intermountain Health. So I kind of just worked whatever role they needed, PRN, and finally got an offer for a part time position every other weekend in one of our emergency departments. So that's what I'm doing now. It's pretty low acuity, but emergency medicine was one of my favorite rotations during pharmacy school. It's one of my favorite areas to be in. Um, so it just it was just kismet, I guess, because I had experience working in emergency medicine as an intern, as a student, and then they needed a pharmacist who was willing to work every other weekend. So the goal right now is to continue this job. However, I have been advised lots of different things from quitting to going very, very per diem because I might need to be studying on the weekends for certain exams. So I'm trying to work that out with my bosses right now, actually, to maybe going down to 1 weekend a month or doing something more flexible.
Yeah, that's definitely a tough decision. When I typically discuss like working in medical school, it's absolutely possible. Same idea with you were able to work in pharmacy school. Well, the same thing applies for medical school. You end up finding the time to make it work. Just depends on, your stress tolerance. But so that's awesome that they're able to work with you though, and you're serving in a clinical role, which I think is really unique. A lot of pharmacists are working per diem shifts at, like, their CVS, but you're actually able to be in the hospital. So I think that's really cool. And obviously figuring out how you can kind of incorporate your pharmacy background, still make a little bit of cash on the side, is also important. And a lot of people will ask me too personally, like, does working in medical school help you with residencies down the line? And I would argue that it does, but only to a certain extent. So, like, for having finished and done the residency process myself, I would say it helped, getting the hours because it's a unique experience and kind of keeps you sharp with the pharmacy world. So that's like a bonus right there. But also, after a certain point, though, it's kind of diminishing returns on your investment. So don't overburden yourself, or any of our listeners who are considering that in the process. Definitely work as much as you can, but don't overdo it. So, and it sounds like you have the awareness of that right now. So I love it. With medicine, starting medical school on the horizon, what are you looking forward to most?
So they have changed the curriculum at the state school here. Um, and I think I'm looking forward to all of it. I think just having the title medical student is going to open up so many opportunities that I didn't have before. Research opportunities. They like to advertise that if you want to shadow any subspecialist, they have them all here except for aerospace medicine. But just being able to reach out to any physician and say, hey, can I come and chat with you for a bit will be great, because I felt like that was part of one of my challenges with applying to medical school. Despite having a clinical role, it is still hard to find physicians who you're able to shadow and then finding the time to do that. Research opportunities. I am excited to get back into research because I haven't done very much since pharmacy school ended. And I really want to learn how to diagnose patients and work in the clinic. So I'm looking forward to a lot of things. I guess everything feels like it's going to be new. I told some students who will be in my class, like, hey, I can help you out with pharmacology, but you're going to have to teach me anatomy because I haven't taken anatomy in like 6 years and it was very basics. There's a lot of new stuff that's going to be happening in a few months, and I'm almost overwhelmed thinking about all of it.
Yeah, it's kind of it's one of those things, like, you don't know what to expect until you get there, and then you'll say, okay, like, boots on the ground at this point. Now it's really interesting. Or like, oh, now I understand how anatomy works, and now I'm looking forward to getting out of anatomy. So that's awesome. And so, speaking on, obviously you haven't started medical school at this point, but what kind of physician would you like to be, or are you interested in pursuing at this point in time?
Yeah, so again, I'm very goal oriented. I like to think about my plans 5, 10 years in the future. Right now, actually heavily leaning towards anesthesiology. So I was very excited to see that you also went that direction.
Perfect.
Um, I'm also interested in pain management subspecialties. So um, I have some like personal experiences with people who have struggled with chronic pain. And so I feel like that would be very fulfilling for me. And I'm also looking at possibly working for the government in the future. So the pain management would also like slot in very nicely with the area I'm looking at working in the future. So I'm trying to be like a little bit vague because I'm not 100% sure. I'm also interested in psychiatry, which is completely opposite, but I went ahead and finished a cognitive neuroscience minor and a chemistry minor while I was doing my biology degree, and got a little bit more into psychology and psychiatry. So kind of all over the place, but I have some ideas of where I want to go.
Yeah, and that's totally fine too, because the general consensus is that you'll change your profession or what you think you're going to go into 5, 6 times throughout medical school. And a lot of it too is sometimes just like experiencing it and then crossing off the boxes. So you might not know what you want to do, but you know for a fact you don't want to be a surgeon or you don't want to do this or that. But I love to hear the ones that you're interested in now because those are fields that have tons of pharmacology. So it makes sense.
Mhm. Yeah, and I think my background, so I've had a lot of emergency medicine experience. I realized I likely do not want to be an emergency medicine physician, but I still love codes and traumas. RSIs was like rapid sequence intubations was very interesting to me as a student and now as a pharmacist. And I was like, oh wow, I could get all this stuff in anesthesia if I really wanted it. I also did an inpatient psychiatry rotation in pharmacy school, and I can see how these experiences have definitely shaped my interests. So I'm hoping medical school, maybe I get even more diverse range of experiences that help me narrow it down a little better.
Excellent. Well, you're going to have plenty of opportunities for that in the future. So I love it. So circling back to a few final questions, and these are more kind of just broad questions about the profession of pharmacy as a whole, having been serving the profession for a couple of years now. So what do you think like the outlook is for pharmacy as a whole, and how do you think that the profession is kind of transitioning into seeking out alternative or non-traditional careers for pharmacists?
I think the profession is possibly going through a shift right now where we are trying to maybe get more clinical positions opening for pharmacists and integrate more pharmacy work into clinical teams overall. How that works for non-traditional, well, I'm guessing basically any clinical situation there is, whether you're working outpatient, inpatient, surgery, you'll want a pharmacist on a team. Pharmacists save money. They're very strong supporters of the team. Um, I feel like retail pharmacy is maybe getting less of a draw. I know that um, class sizes have reduced recently. The University of Utah is offering free tuition for the first year pharmacy students right now, and they've done
Wow.
that for the last few years. So I feel like pharmacy as a profession isn't drawing as many new students, whereas physician assistants, PTs, RTs, MDs, DOs are maybe increasing.
So, how do you think we can do a better job of sharing alternative career opportunities that maybe younger pharmacists who are just getting started might not know about, particularly this transition into medicine?
I think that networking is always super important. Before I finished pharmacy school, I was actually looking for any kind of part time position where I would not be in retail. I had done that for 5 years, so I was looking for different opportunities and ways to improve as a pharmacist, especially as a new career pharmacist. So, one of the things I learned about was doing like long term care or even um, remote pharmacy positions. I know some of my friends got into that. So it just kind of ended up being talking to people and promoting yourself and just getting your interests out there. I've always been pretty vocal about my goals, and I would tell all of my preceptors, hey, I am going to be applying to medical school, but I also am going to be graduating pharmacy school. So, is there a position available? What are you looking for in someone who might be switching careers in the next couple of years? And I found a lot more people were open to it than I expected. I did expect more pushback, maybe even some naysayers, I guess, for my switch. But I had a very positive experience where people were just happy for me and were like, "You're crazy, but this is what I would do," or "You can look for this." Um, and there was a lot of part-time job opportunities I found by just talking to people. And for anyone who wanted to pursue pharmacy to medicine, obviously, I would direct them to your podcast, your book. I actually do know another pharmacist who's applying to medical school right now, who we've talked about your book together, and just getting all that research, looking at that cost benefit, especially financially, especially like from someone who's not from wealth. It is a huge financial burden. So you have to just be very aware of what you're getting yourself into. I think knowledge is power. That's what I use. Maybe it's not for everyone, but through networking, connections, and doing a lot of research, you can get all that knowledge. So
Yeah, I think that's great advice too. You kind of touched upon this really interesting point where you were saying that individuals they should tell their community and the local, pharmacy staff that they are considering this switch. And I know for myself, and like you had expressed too, where I was very apprehensive to tell some of the pharmacy professors, like, hey, I like pharmacy, but I'm also jumping ship. And I
mm-hmm.
think that is like kind of hard to approach, maybe, pharmacists, because we're very proud of what we do, and the schooling we do is very hard. So I think, sometimes they might not totally understand, or might feel like that they may, be kind of like taken aback by switching over. So the fact that you were able to, though, then kind of overcome that and just ask and tell them, you're being true to yourself there. And you never know who they might know. Like, oh, they'll think back, oh, I had a friend or a classmate that I graduated with who did the same thing. Here's their
Mm-hmm.
contact information. And you've just opened up so many doors and so many opportunities right there. So it doesn't hurt to ask. And it sounds like you had a lot of benefits from doing those things.
Yeah, absolutely. I guess I would just follow that up with, yeah, I was very scared sometimes to tell people, especially preceptors on rotation. You're trying to impress and get, good curates and everything, telling them that you're not applying to residency and you're going to medical school. It was very scary, and it took me a while to tell that to people. But I did tell my mentor. My pharmacy school mentor was a professor, and her husband was a nephrologist. So, like, right there, she was like, "Oh, you want to go to medical school? I thought about it before too." Um, there were so many pharmacists who said the same thing. Like, I thought about doing medical school too, but I didn't end up for this and that reason. So, yeah, it was great.
Fantastic. Alrighty, well, we're getting to the end of our interview today, and I think it's time for the famous 3 questions. And these are the same 3 questions I ask every individual who comes on the podcast. So, starting out with number 1, how do you maintain some semblance of a work life balance in your demanding profession?
I think everyone knows their limits. I could be wrong. It took me a while to find mine, but obviously, being a people pleaser, being a pharmacist, being a student, and being a high achiever, you can definitely overburden yourself. So learning how to say no, taking time for yourself and your family is super important. I do a lot of scheduling, like
Hmm.
for this interview, it's my day off. And so I knew I had time to do this. On the day I was working or had class or something, I would not be here. So I had to say no to a lot of things, and I couldn't I couldn't go to every single event I wanted to go to. But it works for me. I need time to myself. I need to recharge at home. So you just got to say no sometimes. You can't do it all.
Exactly. And I think that's great advice too, because if you have your hand in too many buckets, then the quality of work that you're able to do for each of those individual tasks degrades by a certain percentage. And your focus, might get to the point where like you are underperforming in some of those, facets of your life. And that can lead to even more problems and more headaches down the line. So the cost of adding one extra opportunity might not be worth the kind of the repercussions of that. So I think that's really good advice. And getting to question number 2, do you have any last minute recommendations to students or pharmacy graduates who are interested in going to medical school like yourself?
I would say it's very scary, but very rewarding. It's not a usual pathway, and you are going to be a trailblazer doing this thing that, a handful of people have done. I think it's growing, but it still feels like, 1 in 1,000 people might have done this transition. So you just got to believe in yourself and keep pushing if you really want it. If you don't really want it, you might find it hard to keep going.
Exactly. And I think too the big message in that statement there is you're not alone in this process. It's the whole purpose of this podcast, the platform, everything where like you had mentioned previously, it's very isolating to make this decision because you feel like you're in a silo while everyone else around you has gone on and done different things and kind of followed the traditional pathway. So just keep that in mind when you're having like those long days. You're doing this for a reason and it's going to be the best outcome possible when you get down to the end of it. Alrighty. And so for question number three, what are your personal, professional, or business oriented goals that you'd like to accomplish in the next 5 to 10 years?
Personally, I think personal growth is very important. I've been just working harder and harder to become the best version of myself. I think pushing myself to meet my goals has been like part of my growth, I guess. What I'm trying to improve upon, for one, I'd like to get better at interviews and presentations, kind of a professional and personal thing there, but improving communication, making sure I have that time in my relationships, that I'm actually putting the time there. Especially, I'm getting married this summer, so I've been thinking about that a lot. Like, relationships are work and they require you to put time and effort into them. So just being real cognizant of that. I also plan on prioritizing mental health a lot this year. I found out that my university offers free therapy, so I'm going to be taking advantage of that. Professionally, I kind of touched upon it, but I'd like to get more into research because I feel like research is hard and I feel like I can push myself a little bit more as far as critical thinking if I get involved in something maybe a little bit more challenging. But I haven't started med school yet, so I'm still very nervous about like how I'm going to handle all of the workload med school has. I think that might be a challenge in itself. I also want to be a better pharmacist. So now that I'm done with school right now, I have been trying to focus in a little bit more on reading studies, focusing on guidelines, kind of teaching myself a little bit more about becoming a better pharmacist and practicing. I didn't talk about it too much, but that has kind of been a struggle as far as learning how to be a pharmacist while doing all these other things has been like having my hands in too many buckets. And business, as far as business goes, I'm not very entrepreneurial myself, but I like to um, advertise myself, I guess. So branding is important to me and like networking in general. So hopefully I'm putting out a good version of myself to other people and I hope to mentor others and um, I don't know, be putting myself in a good light out there, if that makes sense.
Absolutely. And speaking on the mentorship too, that's something that I'm looking forward to myself. Like after finishing out this residency process and everything would be like having my own pharmacy rotation and precepting like medical students and pharmacy students. I think that'd be a really
Yeah.
cool opportunity to kind of give back.
Yeah, that's awesome. I definitely think mentorship got me to where I am today, especially being first gen and first in healthcare. So as much as I can to pay that forward, it would be amazing.
Wonderful. Well, looking forward to all those great things.
Thank you.
Alrighty, so we've come to the end of our interview today, and I'd like to thank all of our listeners for the support. If you have any additional questions about the medical school journey, pharmacy practice, or entrepreneurial topics, check out my website at www.physicianpharmacist.com. Before we let you go, how can our listeners get in touch with you or learn more about you?
Yeah, so you can find me on LinkedIn. That's probably an easy way to get in touch with me. My name is Samaya Cristina, which should be in the show notes, or you could just Google me. Um, and yeah, I'm always open to hear messages from you guys. If you message me, I can definitely give you more contact information.
Wonderful. All right, Samay. Well, thank you so much for your time today. I really do appreciate it. And I think we had a great conversation, and a lot of listeners will kind of benefit from hearing your words of wisdom.
Thank you so much for having me.
All righty. Take care.